All right, y'all. We've made it to our last session of the day, and I'm really excited for this closing keynote from my friend and one of our partners of our office, Shantay Jackson. So Shantay Jackson is the director of the National Offices of Violence Prevention Network at the National Institute for Criminal Justice Reform. In this role, she is responsible for the strategic evolution of the network's support to OVPs, including its growing membership, cultivating a leadership pipeline, coordinating with national TTA partners, and assisting with the jurisdictional institutionalization, that's a hard word, of offices. And Shantay is passionate about advocating for social justice issues, and prior to NICJR, she served as the founding executive director for the Mayor's Office of Neighborhood Safety and Engagement in Baltimore City, as a member of Mayor Brandon M. Scott's cabinet. She was responsible for addressing violence as a public health issue, serving as the accountability partner for all city agencies and local, state, and federal partners, delivering public safety policy recommendations, and conducting meaningful engagement with Baltimore City's neighborhood in the work of co-producing public safety. I just want them to know everything that you've done, Shantay. And that's not even everything. But with that being said, I'd like to welcome Shantay to the stage.
Thank you. Good morning, y'all. Don't y'all hate getting y'all bios read? Jeez. Hey. It is really good to see familiar faces in the room this morning and to meet some new ones. How is everyone? How's the last day been? Yeah? Good. So this morning, I'm hopeful that we are going to be able to have an interactive conversation. Those of you that know me know that I don't do really good up here on the stage. I like being with my people. And you also know that I don't like talking at people. I like talking with people. So if you haven't noticed yet, I've already started talking to you in Hoover. That's a hint for y'all that hadn't downloaded the app yet. There's a couple of questions out there for you. But I want us to have a conversation about what defining success and the violence reduction work looks like, and about how we'll know when we're done. Like, how will we know when we're done? So, y'all ready? We're going to start the conversation with a lot of questions. I believe that questions create clarity and a shared understanding amongst us before we even talk about what success looks like. So these questions are ideally going to lead us to an agreement around what success looks like in this work by the top of the hour. Questions like, what is success? Questions like, whose success are we talking about, and who gets to tell us if we're successful or not? Questions about who tells us when we're done, when this work is done. Like, whose responsibility is that? And how do we measure what done looks like? All right, let's jump in. Here's where I'm coming back to y'all so we can have a conversation. I'd love to hear from 3 people about what your personal definition of success is. Anybody? I told you I was going to talk with y'all. Personal definition of success?
All right. Here you go, Tony.
For me, it would be the ability to be able to love and care for people. Because at one point in my life, I didn't care about nobody outside of my family. And so, long as I can think, I can heal, as well as invest, I love and I live. So my success is being able to enhance the generations behind me, because there's a generational curse on my family that every one of the men in my family have experienced incarceration or didn't pass the age of 19. And so for you to ask that question, my ability to not be imprisoned by what society has labeled me as.
Come on now. Thank you. Anybody else? want to share their definition of success? I see it. Oh, all right. I didn't know Sierra was going to be my personal Vanna White, turning you know?
My personal success is who I am and what I do, and have become mature in doing what I've done for over 40 years. When I first started, it was all about who I can put handcuffs behind. As I mature, it was all about protecting and serve, and the dividends that I received when someone come back and said, thank you for just listening. Thank you for giving me the opportunity. I had a young man one time I was going to lock up for child support, and he said, give me the opportunity. Durham Rescue Mission is going to help me get a job. I didn't lock him up. I just took him on his word, let him go to Durham Rescue Mission. And that man's successful. He owns his own home. He's a truck driver. He lives in Durham. And thanks because I gave him that one opportunity, and Durham Rescue Mission helped him. That's what I call success, giving somebody else that opportunity.
Thank you. I think I saw one more hand. Oh, right here in the middle, not too far to run, Sierra. Oh, okay, you got some help there.
I don't got to stand up, do I?
No, not
Okay.
at all.
So I just created something that came to my mind. What I put down was my definition of success is results from realistic goals that were set and accomplished through resilience, commitment, dedication, even if you have barriers against you.
Nice.
So,
Thank you.
and that's me.
Thank you. I appreciate y'all sharing that.
Is it on? Is it?
So let's go into the clinical definition of success, right? So Webster's dictionary defines success as a favorable or desired outcome. Oxford's dictionary defines it as an accomplishment or of an aim or purpose. But what we all know to be true, just based on the 3 examples that we heard in this room, is that success is highly objective, or subjective rather, right? What success looks like to each of us is different, whether that's educational attainment, whether that's wealth, whether it's doing societal good, whether it's being there for our friends and our family. It absolutely looks different for everyone. And while none of these definitions are individually right or wrong, in the field of gun violence reduction, we've got to lessen the subjectivity around what success looks like. In this field of gun violence reduction, we've got to make sure that we narrow in on both quantitative and qualitative measures of success as a field, right? And then bring that down to the culturally and geographically relevant spaces. It's what I call standardized customization, the oxymoron that is, right? So I want to jump in and kind of tell y'all a story before we go a little bit deeper. And I shared this with Sierra a few weeks ago when I was thinking through what this presentation was going to be. And Sierra's like, I'm thinking that we close with like, what does success look like? So a little over 20 years ago, yeah, no, I only look 20, but that's Oliver Lay and hair dye. So a little over 20 years ago, I worked in corporate America. And my mother and I were having a conversation about success. I remember it like it was yesterday, every time somebody talks to me about being successful. She asked me if I thought I was successful. And I said, yes, and I'm becoming more and more successful every single day. So then she said, how do you define success? And I had all these things to say, things like, I'm getting increasing levels of responsibility at work, and I'm the lead person every time we do a merger and acquisition because I'm the data person, and I'm able to make more money and take care of my kids. Like, I'm successful. And then my mother reminded me how often my job required me to travel. And she said to me in a way that only a parent can, baby girl, success is also defined by what you give up to get it. Right? That's that real mother stuff, right? When you just be like, dang! And I swear to goodness, not too long after that, I left that corporate America job, right? And like that was a pivotal moment in me making that decision. So we're going to talk about that today too. We're going to talk about success to what end? What are the things that we're going to have to give up to get it? And what are the things that we better not ever give up in order to get there? The other things that we're going to talk about, as I try to read my notes from this very small phone, are going to include, and who's the we? Who's doing the work? What work are we doing? And what does done look like exactly? So let's talk about who's doing the work. I'm going to poll the room and ask you all to kind of join in here with me in a couple of minutes. So as we think about the actors associated with this work, talking about the field in general, right? Those folks that are seen as leaders in the violence reduction space that have been around even longer than the 1990s when the first Office of Violence Prevention got established, because CVI goes back to the 60s, y'all. We didn't call it CVI back then. I think that what my mom called it was communal parenting. Back then when everybody was your mother and everybody was your father, and there was this one lady looking out the window all the time on the block, and she was the mom of the block. But as we think about what this is and who's doing the work, we're talking about folks in the field. We're talking about how work is happening at jurisdictional levels. We're talking about offices of violence prevention. We're talking about law enforcement officers. We're talking about community-based organizations. Now, what's also important as we think through this and makes it even more complicated is that there are levels to done. There are levels to done. Let's think about that for a second. So I'm talking about two levels, with the highest level of done being about the achievement of our vision. That North Star, the world that we see in our mind's eyes when we've worked ourselves out of a job. Like, that's done. That's done. Right? And then the next level is the supporting level. It's the level where, we've got missions that we've got to accomplish that actually get us to that North Star. By way of example, and I share this example frequently, NASA's vision used to be the leader in space exploration, aeronautics, and space science. And we know that one of their first missions was getting somebody to the moon. So want to be really clear as I contextualize the conversation that we're going to have today about violence reduction work. Our focus is going to be on our most current mission. Our most current mission. So before I dig into the work a little bit more, I want to see who's in the room. By show of hands, whose work is in violence prevention? And whose work is in violence intervention? And whose work is in community transformation? Anybody not accounted for in those three, can we see your hands? So over the last day, you all have heard a lot about primary, secondary, and tertiary prevention. As we continue to unpack this conversation about success and what it means to be done, I want to take a minute to reframe the conversation. I want to take a look at this slide and talk about how it correlates to our respective missions and our collective vision. So what you're looking at right now is what I call the violence reduction spectrum. Collectively, prevention, intervention, community transformation make up violence reduction. I'm intentionally emphasizing reduction because there's often a variation of understanding around what's meant when we blanketly say we do the work of violence prevention. And we already know that we haven't all come to a shared understanding just yet around what community violence intervention is, right? So while all three of these components are necessary to get us to the ultimate done, that North Star that I mentioned before, the one where we worked ourselves out of a job, each of us has to understand which component we operate in and how it aligns with our missions. At the end of the day, we've got to know what we've been charged with doing, and some of you haven't been charged with anything. That's a conversation that I have frequently across the country, supporting over 70 offices of violence prevention. And when I go to them, I'm like, what'd your executive tell you your charge was? Like, what's your job? They don't have a charge, right? So how do you know when you're done? How do you know what success looks like if you have no charge? For others, the executive's given them a charge. For example, has your executive told you that you need to reduce violence in the short term in a year or less? Anybody? Hey, I need gun violence down by this time next year. Anybody? Nobody, huh? Nobody in the room got a charge, I guess. If that's the case, then standing up a mentoring program or a restorative practices program, while those are great and necessary for our community, it isn't your work. Because the time horizon associated with seeing the outcomes necessary for mentoring and restorative practices is 5 to 10 years. On the other side of that, if you're doing neighborhood transformation and revitalization work, that's not going to get you to where you need to be either. Again, important, equally important, which is why it's a part of this spectrum, a part of this continuum, if you will. For most of us, we've been charged with reducing violence in the short term. And what that means is that we've got to be doing the work in this mission associated with intervention, because that time horizon is 1 to 3 years. Every decision that we make about our work, given this mission, has to keep this in mind. What's the outcome? What are the results that you've been charged with delivering? And if you've been told you need to reduce gun violence by 15%, which is what my mayor told me, in a year, I can't do that if it's going to take me 5 to 10 years on the prevention side and 15 to 20 years on the other side of community transformation. So squarely knew where my mission lined up. And it's important for all of us to know that. For the purposes of this talk, this is mission 1 for us on the path towards success. Now, spoiler alert, I want to be really clear that we're not done until all those things on the violence reduction spectrum are done. We are not done until gun violence doesn't exist in our communities anymore as a disease, and neither do the contributing factors to gun violence. So again, we're grounded in the mission, this mission 1, not done. So let's talk about what you've got to consider as you think through where you are on mission 1. That looks pretty small. Can y'all read that? Okay, y'all eyes better than mine. My eyes are seasoned. I'm struggling right now. So you've got to consider what your political governance structures look like. Do you have governance in place? Your mayor, your governor, whomever serves as your executive body, have they put a governance structure in place that is rooted in accountability around gun violence reduction? Does everyone know where they sit in that governance structure? What annual SMART goals have you set for violence reduction? Anybody in the room willing to share with us what you've been charged with reducing violence by year over year? I want y'all to listen to the crickets in the room. Oh, I didn't see a hand. So that's telling right there, right? Because what that means is that you've got to have a clear understanding of this before you can even figure out how to measure success. If you don't have a charge, if you don't have a series of specific, measurable, attainable, realistic, and timely measurements, then there's no way you're going to ever know if you're done. You're never going to be done. Does your jurisdiction have a comprehensive and co-created multi-year violence reduction strategy that includes key performance indicators? I don't want to hear that you have a comprehensive violence reduction strategy if your community didn't help you write it. Because then it means it belongs to you and not to the people who live, work, play, and worship where you do. Right? Do you have an Office of Violence Prevention or a Community Safety Initiatives Office or an Office of Neighborhood Safety or an Office of Safety and Engagement? I will tell you that 4 offices in North Carolina are members of our network. Many of them represented here today. Charlotte, Mecklenburg County, Greensboro, Fayetteville just joined, and obviously the national or the state level office are all members of this network. If you don't have an Office of Violence Prevention, quite frankly, it is likely that your jurisdiction is not taking a collaborative, comprehensive approach to addressing public safety through the lens of public health. It is likely that you're still leaning only into what I call the 3 Ps: imprisonment, prosecution, and policing. And if your homicide per capita rate is greater than 10 per 100,000 people, there's no reason you shouldn't have an Office of Violence Prevention. Have you institutionalized the work of the Office of Violence Prevention? I want to talk to y'all about what that means to me, institutionalization, right? Because in this last panel, and unfortunately was unable to get here until late last night, but in this last panel, there was conversation about permanence, right? So institutionalizing this work, especially given what might become the unfortunate reality of the National White House Office of Gun Violence Prevention, which is also a member of the network that I direct. It's really important that at the local and the state level, folks are thinking through what institutionalization, which translates into there's a law on the books that says that my OVP exists. It's not an executive order. Because I'm grateful for the Biden-Harris administration. They've executed more executive orders than any administration in history. And if we recall what happened after what will be our next president did when Obama left, it is likely that we will have no more executive orders, that they will be undone, right? And so even if you have a jurisdiction where your OVP's been established by executive order, it's not protected from administration to administration. If you compare that to law enforcement agencies, many of those are written into your charters. Many of them are written into your legislation. And so in order to truly make sure that offices of violence prevention and the community-based organizations that they work with, that they should be partnering around funding, have a level of permanence, then you've got to be asking questions around what institutionalization of the work looks like. That means it's written into your charter locally, or you created an ordinance that's passed legislatively, or it's written into some level of state statute. And it's not just written into it. It's the money connected to it. Don't write me on the books and not write a $sign next to my name. So those are conversations that you all have to be having as well. What do your policymaker relationships look like? I think the last question that got asked was associated with like policy coalitions and the mobilization that could be happening at a local level to ensure success. I don't know if the brother from the Equal Justice Institute is still in here, but there are coalitions like in the state of Maryland that fought for 2 consecutive years to get an Office of Violence Prevention codified, to get Medicaid written onto the state books to pay for CVI before the Biden administration announced it as a part of an executive order that will likely go away, right? The Live Free Illinois is made up of a group of faith-based institutions and partners who are actively working on an ordinance to codify the Office of Violence Prevention in Chicago. And so you want to think through, what do your relationships with your policymakers look like that set you up for success? And even what those relationships look like with the policymakers that don't like you or your work, especially them. We'll talk more about that. What does your violence intervention infrastructure look like? Is it all law enforcement? Is it all community-based? Or is it a beautiful blending of both that allows for separation of duties and responsibilities, but understands that when delivered effectively and delivered constitutionally, that policing can support communities and community can support communities? That there are going to be times, depending on the situation, where no police should be there and only community should be there, and there will be times in communities where law enforcement presence is necessary for the general public safety associated with what might be going on. So what's that infrastructure look like? I tell OVP directors all the time, you need to go together with your police chief. I'm dead serious. The chief in Baltimore City and I, even though neither one of us is there now, talk to each other every day. And that is why by the end of the year, last year, we had strategies in place, and Baltimore saw less than 300 homicides for the first time since the death of Freddie Gray in police custody. Because we worked on it together. We maintained separation of duties and an understanding of the intersectionality of our work. It is why the first time since 2011 that Baltimore is on track to have 200 or less homicides this year. And so what does your working relationship look like between your community-based organizations and the police department, and in cases where CVI orgs don't need to have a relationship with the police, because there are times when you don't? How does the OVP stand in place to make sure that what needs to get done gets done by way of passing information to community-based organizations to reduce the likelihood of retaliation and or other components of your work? Is your jurisdiction's performance management data-driven? Are y'all just popping up in places? Or do you have access to data? And how frequently do you have access to data? One of the first things that I did in Baltimore, because I told y'all I was a geek, right, back in corporate America, was we created a public safety accountability dashboard. You can see it to this day. It's updated in as close to real time as possible. It's off by maybe a couple of hours. And you can drill down into the neighborhood level to see what's going on in your neighborhood every day, which I do, whether I'm home or not. But these are the types of performance tools that you should be building in partnership with folks that are part of this comprehensive suite of public safety in order to determine how you get to success. Yeah? So I've shared, or I'm about to share, a screenshot here. There is a national report called called Key Actions for Citywide Gun Violence Reduction. It's a 3-city case study done by our partners at California Partnership for Safer Communities. I would encourage you all to take a look at that as you think through considerations around what should I be asking? What conversations should we be having as CBOs, as law enforcement agencies, as offices of violence prevention, and as residents in general around, how am I going to make sure that I know when we're done? No pun intended in my George Bush voice, but when is mission accomplished? When is this first mission accomplished so that we know it's time to create the next mission to get us to the North Star? Let's take a look at a couple more considerations here. And then I'm going to pause because I want to check in with y'all. So, does cross-sector collaboration exist? And when I say cross-sector, I'm talking about all of your city agencies, because every city agency either contributes to or detracts from public safety in one way or another. But not just your city agencies. What about your community-based organizations? What about your institutions? What about your hospitals? What about your faith-based leaders? What about your business partners, the small, medium, and the large business partners? Is there a level of cross-sector collaboration happening so that you can take an all hands-on-deck approach to reducing violence? Y'all have talked about this a lot over the last couple of days. What does direct service coordination look like? What's your CVI ecosystem look like? How many of y'all fighting each other? As somebody that used to run a CBO, I used to fight. Right? Whether it's because you think you provide a service better, or you know that funds are limited. Right? My personal mantra is collaboration happens at the top, competition happens at the bottom. And we got to ask ourselves where we want to be. Even given the fact that much of our reactions and our responses are rooted in a scarcity mentality that's directly connected to the traumas that we've experienced as Black and brown people. How do we get past that place where we have developed healthy CVI ecosystems? And I'm gonna maybe counter a point that my sister made on the last panel, maybe not. We get to, duke this out over some drinks after this thing is done. But I'm a huge advocate of making sure that there's redundancy within a CVI ecosystem. And so while I don't want folks saying, hey, how many different lanes can I jump into? I do want folks focusing in on what they do well. But when I'm conducting landscape analyses across the country, I'm asking them, and tell me who does it as well as you. Because to a point made earlier, a lot of us have capacity constraints. And I am grateful that we have stood in the gap because we've had to, right? We're doing all the things because our communities need it. And what's the one thing you do well? And don't tell me what you think you do well. Tell me what your participants come to you for most. Because then that means that's what you do well. And then the next thing is, and who does that thing as well as you? Because when you have capacity issues, who am I handing off to? So that you're, just continuously building the CVI ecosystem, continuously creating collaboration opportunities for each other. And I would offer that if you are a funder, either via an OVP or a law enforcement agency or some other mechanism, that you absolutely mandate collaboration in your RFPs. Mandate it. Incentivize it. Give out more money for folks who are bringing a collaborative partner, and make sure that they have a letter of support attached to that and not just the name. Yeah? How positively provocative is your storytelling? This has been a theme since I've been here today, too. We can control what goes viral. Virility isn't inherently, or provocation isn't inherently negative. I'm all about how do I tell provocatively positive stories? How am I shifting the narrative? How am I making sure that folks know what's going on? How am I making sure that the story about gun violence reduction being down 25% this month runs as long as the story of a 15-year-old who was brutally murdered? And not to devalue his life, but that story will run every night for 5 nights. And a story about the work that we're doing will run for 15 seconds, if that, one night, right after a commercial clip when everybody's in the bathroom. Right? So what are you doing to create positively provocative storytelling? How are you leveraging the influencers in your city? All of us got them. You know who gets the most engagement on social media in your communities. How are we leveraging those folks? We talked about this too. So what does programmatic research and evaluation look like? Are you evaluating your programs every 2 years? If you aren't, you need to be. And not you, an external evaluator. And then using those evaluations to make systems changes. This directly connects to your ability to maintain funding, right? So what I share with folks is programmatically evaluate every 2 years, fund your CBOs for 3 years. Throw away the 1-year contracts. We're not doing that. My first year is a foundational year. I'm hiring team members. I'm trying to get stuff together. I'm developing relationships and rapport. You got to give me a few years to actually prove that the work is working. So evaluate every 2 years, fund your community-based organizations every 3 years. And if you do that, technically, you should have at least 6 years as a community-based organization, because that evaluation should tell you what's working and what's not, and then you either deepen and or make changes. Are y'all with me so far? Okay. Because I'm geeky when it comes to this sort of stuff, so I could talk about this for a while. The last thing here, do you have a shared violence reduction taxonomy? So I'm going to come back to the question that I asked y'all a while ago. So given what I shared with you on the violence reduction spectrum, some of you raised your hands when I asked who did violence prevention. Some of you raised your hands when I said who does violence intervention. Some of you raised your hands when I said who does community transformation. I don't care where you land there, but I would love to see your hands if your answer would have changed based on what we just went through on that slide. Anybody? So all of you would have stayed in prevention, that selected prevention. So you're in the 5 to 10 year space is what you're saying. Yeah? Okay. And those of you that said intervention, you're in the 1 to 3 year space. And those of you that said community transformation, that means your mission is 15 to 20 years. That's kind of where we're going. That's what we're saying right now. That's interesting to me because nobody raised their hand when I said, what charge did your executive give you? How do you know what space you in? You figured it out. You answered the question. You and your people talked. I'm serious, right? And so if we're looking to define what success looks like, you don't even know which of those 3 lanes you're in until your executive, your CEO, your whoever it is that's going to wind up being the one that funds you, the one that sustains you or throws you away, tells you what your charge is. And so I hear y'all saying y'all think y'all know. I would encourage you to go back and double check some stuff. Okay. Here is another report that I want to share with you all. These are the 10 essential actions. This one here down at the bottom by CCJ. This was produced in partnership with the Department of Justice, the Bureau, the BJA there. These are 10 essential actions that we know work for cities who have seen sustained reductions in violence over time. You can find this on the DOJ's website, on the BJA page. As someone who works really closely with the BJA and its delivery of these 10 essential actions, in addition to partners around the room that are doing the same work, I would encourage you all to take a look at this, because this will also inform what you should consider as you step through Mission 1. All right, so we're going to close out here, and I'm going to talk to y'all about when you're done. Like, when is Mission 1 done? Again, making the assumption that Mission 1 has everything to do with a 1 to 3 year time frame, that you're looking to reduce violence as soon as possible in your communities, right? First thing, comprehensive and co-created multi-year violence reduction plans. What I recommend to folks is a 5-year strategic plan. Anybody know why? You don't get to say why if you're in a network, because you already know. 5 years because it expands outside of an elected official's term, number one. And number two, because of the time that it's really going to take in order for you to solidify a strategy, right? The first year is your foundational year. Second year is your framing year. Third year is your securing year. Fourth year is your, I'm trying to remember my dad's thoughts here, because he's a general contractor, and my first job was hanging sheetrock at 16. And so, like, the stages of building something, it's typically 5 stages, right? That first year, you're piloting things. You're using evidence-informed strategies. You're seeing what's going to work. You're using the data. You know when you're done with Mission 1 if you have a comprehensive violence reduction strategy that is 5 years long and was co-created with the people that it's meant to serve. That you have sustained 10% or greater reductions in violence year over year in both homicides and non-fatal shootings. Some jurisdictions don't even capture non-fatal shooting data. That you are seeing reduced incarceration rates. That you are seeing higher law enforcement clearance rates. That 70% of your homicides are being cleared, 45% of your non-fatal shootings are being cleared. And believe it or not, you can have higher law enforcement clearance rates and lower incarceration. In fact, they work really well together if you're providing people with the services and the resources that they need to lead the life. This has been proven to work in jurisdictions across the country. We talked about the institutionalization of the work. This is not just about an OVP. This is about institutionalizing the work of your CBOs too. Because at the end of the day, just as your law enforcement agency is institutionalized, has permanence, the other partners associated with delivering comprehensive public safety should have permanence as well. Data-driven performance management we talked about. Man, you've got to make sure that you're looking at what I call ROI, which in this case is not return on investment, but the results, outcomes, and impacts of the work that you're delivering. That there's direct service coordination, that there's a clear kind of pass-through around who gets reached out to when this type of event happens. And then once they go on scene and they're doing what they need to do, how do they determine which CBO or which city agency gets reached out to next? That's the sign of a healthy CVI ecosystem. If you think about your medical care system, I'm going to be really transparent here for a second. So I have multiple sclerosis, right? I think some folks in the room know that. It's typically why I don't stand still often. The beautiful thing that I love about my care system is that all of my doctors are in an ecosystem, and I don't have to tell my neurologist the same thing that I told my primary care, that I then have to tell Kennedy Krieger Eye Institute, that I then have to tell, you know what I mean? They're like reading the case file. They've all talked to each other. That's what a healthy ecosystem looks like. where someone who is traumatized that you're working with doesn't have to storytell their lives over and over and over again. And so how are you building those collaborative relationships through direct service coordination in ways that these individuals feel like they're dealing with one system of care? How you do that is you take your ego out of it. How you do that is you remove territorialism. Okay? I know we were gonna get churchy up in here, but okay. So professionalization of the frontline work. We talked about this, and that's gonna look different for every single jurisdiction. Sometimes it's gonna look like health workers. Sometimes it's gonna look like peer recovery specialists. Sometimes you're going to create tracks for folks who say that they always wanna be an individual contributor, and folks who say that they want to figure out what supervisory work looks like. But professionalization of the field, field-wide collaboration. So this is where I talk to my other national partners, and I'm like, and we can't be competing with each other neither. Right? Narrative change. So how are we changing the story around community violence intervention? How are you making sure that you're being positively provocative? How are we highlighting the work? And quite frankly, in ways where we're shoving it down people's throats in the same way that they're shoving hopelessness down our throats. Routine programmatic research, which we just talked about, and evaluation, quality improvement based on that, and then an impact analysis associated with the work so that you shore up funding. So if I tell you that we had an evaluation by Johns Hopkins Center for Gun Violence, and they told me that my Safe Streets program, since its inception, in the 10 neighborhoods that it's in, has reduced gun violence by 33%, you better keep funding it. And that is the story that I use to get us from 1-year contracts to 3-year contracts. Yeah? And then standardization of taxonomy. We gotta call the same things the same things. You can't be out there saying prevention, and you saying intervention, and you saying community transformation, and somebody saying HVIP, and somebody else saying HBVIP, and like, just, you know, what, like a shared taxonomy across the field, a shared understanding of the work. This is when Mission 1 is gonna be done. What you have here is both a combination of quantifiable metrics and qualifiable metrics. Y'all not done Mission 1 until you get this done. I am confident in each of your abilities to take this stuff back and to have some serious conversations with the folks that live, work, play, worship, and direct your work so that we can get through Mission 1. Yeah? All right, I'm finished talking now. I want to open it up to the floor. Questions, thoughts. What did I miss? Right? Teach me. Like, what are your immediate reactions and thoughts here as you process the conversation that I attempted to have with y'all this morning? We got the mics out?
Thank you, this is very loud, sorry. Thank you immensely for your presentation. I want to say I appreciate your slide that speaks to the intervention, prevention, and transformation. Yeah. And one of the things I've noticed is that sometimes we're institutionalizing the short-term, time-limited intervention. And I'm glad I saw the image of it, because at some point, it becomes problematic if we do that.
So I'm suggesting we institutionalize the entire spectrum.
Absolutely.
And that's Mission 1.
Absolutely. Yeah. But we stay there and institutionalize that piece outside of not recognizing that those other two pieces, where are we trying to go? Community transformation, and then, of course, prevention, however we do it. But I just noticed that sometimes we're just relying on that intervention. And that's where I think community buy-in can wane. Yep. If we don't have a bigger plan in place.
So let's talk about that for a minute. Y'all mind if I go back to the slide? Sister, what's your name? Joanne, thank you. Thank you for your point. Let's come back to this slide. Okay. So as we think about institutionalization and why we're quite frankly hyper-focused right now on institutionalizing OVPs is because much of the work in the prevention and community transformation spaces are already institutionalized. If we think about prevention through the lens of education, and we're thinking about systems like family services and Mayor's Office of Children and Family Success and those sorts of things. I'm not suggesting that they are institutionalized blanketly across the country. I'm suggesting that in many cases, by our definition of institutionalization, which is written into law and permanent funding, like that's kind of the definition that we use. So we've got education squared away. We've got things like recs and parks squared away. A lot of these things are already codified, if you will, into city administrations and governmental administrations in ways that we don't see addressing public safety through the lens of public health. I mean, that's the only point that I'm really trying to make here without discounting your point, obviously, that we've got to make sure that we're playing a long game. Which is why we got to differentiate the vision from the missions that it's going to take to get the vision done. But at the end of the day, this is the vision that we should be aiming for. And to the degree that institutionalization is needed for any of those components, we should be working through that. Other thoughts, questions, responses? What did I miss? Come on, Tracy.
So while you're here and we have some expertise from our national partners, can you speak to how you quantified things that didn't happen? So I think that's been some work that we've talked about before.
Yes, yes. Man, oh man. So depending on the jurisdiction, quantifying something that didn't happen happens in a few different ways. And I am not a researcher or evaluator, so I'm not even going to go into like all of the mixed methodologies that people like Daniel Webster and Shawnee Bugs and all of those folks use. And at the same time, I'll tell you that in Baltimore, based on information, for example, in those 10 neighborhoods that were specifically chosen based on data, right, identified as the 10 deadliest neighborhoods in Baltimore City, based on quantitative and qualitative information from our team members there, we knew for a fact that on average, 7 to 9 mediations involved the presence of a gun, right? Whether that gun got pulled or not, that there was a clear identification of someone either having a gun on their person and or pulling it out and or being known to carry. And so when we're having conversations about the impacts of mediations in Sandtown, Winchester, West Baltimore, where I grew up, I could say with a high degree of confidence that 7 out of 10 mediations prevented a shooting, either a fatal or a non-fatal one, based on that statistic. And so you can measure things that don't happen by measuring what you know to be true as you're conducting things like mediations or street interventions. That's just one example. Again, there's no way that I'm going to be able to speak to the scientific methodology that Shawnee and Daniel can for you based on the prevalence of guns in individual communities. But there are a few ways that folks are measuring what didn't happen in order to inform funding and permanence of programming.
So this isn't really a question, it's more of a comment. I want to thank you for including this slide and talking about intervention, because I think what happens sometimes is intervention gets pushed to the side
in spaces because we are focused on prevention or community transformation. I think that that has to do with those systems being already a part of our institutions, and that's just the thing that people lean to. They say, well, okay, well, you're doing violence prevention work. No, it's intervention. So I want to make sure that in this space, we're clear about incorporating intervention and the understanding that it is a part of this entire continuum. It's not something that you would do for a little while and then you stop doing it. It is a part of the entire cycle. So as we are moving forward, you know, with the strategic plan for the state, making sure that we are intentional about incorporating intervention is going to be a key component to what we're doing.
Turn it back over to you. Thank you, folks. I am hopeful that y'all appreciated the last 2 days.
Okay, one more round of applause for Shantay. Okay, and we've made it to the end of the conference, y'all. Okay, let's just do another round of applause for all of our speakers. Everything, yay. Hopefully you all have enjoyed yourselves over these past 2 days. I'm hopeful that you have gotten the opportunity to connect with new or old colleagues. I'm hoping that you've made some connections, you've learned some things, and maybe you've heard something that's changed your perspective or opened it up, and you'll bring something back to your communities to make your programs even better. And so I'm going to share on the screen. Oh, you went all the way back to your... Okay, well, okay, there it is. You know, we got to do some evaluation. So I've got a QR code on the screen. And we just love to hear your feedback on how you enjoyed the event. This is just going to help us inform the next event that we'll hopefully host. And so there's a QR code, but we'll also send this to y'all in Hula and in emails and maybe for the next week or two. So you've got time to fill it out. On your way out today, when you're stepping out, we've got a little token of appreciation for you all, a challenge coin to just commemorate this event. And yeah, I hope that you all enjoyed it. And that's really all I got for you. Those that are traveling back today, please travel back safely. For our partners joining us at the reception, we'll see you in a few. Otherwise, thank you.